I'm Shannon Weber, Director of HIVE. Every year, HIVE answers hundreds of questions from patients, their partners, and providers. And each week in 2018, we're bringing one of those frequently asked questions to you in video format. For this week's question, I have the most amazing Felipe Flores from San Francisco AIDS Foundation Strut Magnet Clinic to answer a question that we get a lot at HIVE and also at Please Prep Me, which is, how do I get PEP, or where do I get PEP, and how do I pay for it?
Yeah, definitely. So PEP is post-exposure prophylaxis. So it's medication that you take after you've potentially been exposed to HIV. So it's most effective when taken within 72 hours. So the closer to the potential exposure, the more effective it is. So if you know right away, or if you're concerned about something, you can go right away to access PEP. PEP, depending on your area, there can be more providers or less. But what's streamlined across all areas is that you can go to any urgent care facility. You can go to any Planned Parenthood if there are Planned Parenthoods in your area, and most hospitals. So depending on your insurance, like if you're restricted to a certain hospital network, then going directly to that hospital network to urgent care, messaging your provider if you're able to, and letting them know about what happened, and asking for a prescription of PEP. In terms of payments, it varies a little bit depending on your plan, but there are copay assistance programs, whether you're insured, uninsured, and really depending on the regimen of PEP that your provider is prescribing. There are slight variations depending on the comfort of the provider. All of them have been shown to be effective. So it's mostly a matter of whatever your provider is prescribing, activating the different copay assistance available to your insurance plan and to your income requirement.
Awesome. And so if this feels overwhelming, a tip for people is that they could get help from a PrEP navigator.
Definitely. So there are PrEP navigators like myself and my team who are versed in all the different copay assistance programs, who can guide you through the process, whether you're uninsured or commercially insured, publicly insured, depending on whatever the situation is. They can guide you through those steps and making sure that you pay ideally nothing. And with the copay assistance, the vast majority of PEP clients end up paying nothing either way.
So it occurs to me that because of the window of time, so we want to get PEP within 72 hours, if this is, well, first of all, if I think I need PEP, I need to be specific about that when I'm reaching out to my provider and making an appointment, like saying, not just I need to chat with you or I want an appointment, but I need PEP. So they realize it's urgent and they could do it over the phone.
Definitely.
But what do I do if it's a Friday and then it's the weekend and then here goes a bunch of my 72 hours? And so say it's Friday afternoon, and I'm thinking that it would be a good idea for me to get PEP. What do I do?
Yeah, depending on your area, there are clinics, usually sexual health clinics will have starter packs. So either if they're not able to do like a full appointment with you, they can at least give you a few pills so that you can begin your treatment right away. And then they would schedule you depending on their availability. Another thing to do is, again, most hospitals, most like general hospitals will offer starter packs as well. And they're connected to a network where they will be able to refer you to a clinic that maybe specializes in it in a bit more so that they can access the full prescription and complete the 28-day regimen.
And help you with your getting the coverage. Yeah. And then urgent care would be the same thing for the weekend too.
Definitely. Yeah. So urgent care facilities, again, looking up the different copay assistance because not every urgent care facility is versed in that. So doing a little research, either on gileadcopay.com or mysupportcard.com are some common like support copay assistance programs for people who are insured or uninsured to pay for the vast majority of PEP regimens.
All right, awesome. And at pleaseprepme.org, you can actually search among the PrEP providers and filter for locations that offer PEP. So it's not an exhaustive list because there's obviously places that do PEP that don't do PrEP. And also we have online chat. So from 9 to 5, Monday through Friday, someone can help you figure out how to find a PEP provider and also how to do the medication assistance program.
Yeah, Please Prep Me is a great resource. So I definitely recommend it for anyone.
I didn't even tell Felipe to say that.
Yeah, we use it all the time. And I definitely encourage anyone who isn't familiar with the landscape of HIV prevention or treatment to look on pleaseprepme.org.
Awesome. Thank you so much, Felipe.
Thank you for having me.